It's my pleasure to welcome Sheridan and Belinda from the Mana Mothers Hospital, who are here today to share some of their tips on baby handling. So it's my pleasure now to hand over to Sheridan.
Baby development and baby handling. But what I thought I'd do to start with is talk a little bit about mums. So what often happens, or I think it happens 100% of the time actually, is that when you're pregnant you take lovely care of yourself. In fact, other members of your family take lovely care of you as well. And then as soon as you have your baby, all the focus and attention goes to the little person and you stop looking after yourself quite as well. And it even seems to be that the more little people there are, the less mums are looking after yourself. So I'm just giving you a little reminder that I want you to remember after you have your bub to make sure you look after yourself. And this can be a good one for dads and grandmas as well to just remind mum to look after number one. So the first thing I'm going to look at is comfortable sitting positions, which is great because you guys are all sitting, so we may as well get you comfortable. So what I'm going to get you to do is to wiggle your bottom right to the back of the chair, and hopefully there's something giving your lower back a little bit of support. These chairs aren't too bad. It probably depends on the size of your bottom, how much support it's giving you. If you need a little bit of extra support in there, maybe you've got your jumper, your scarf, some brochures that you might not be reading that you can pop into the small of your back to give you a little bit of support. So definitely as soon as we help ourselves with that lower back, it tends to bring everything else up to a good position. Always love it when I see mums in the hospital after they've had their baby and they're sitting up nice and tall and their shoulders are relaxed, rather than when I see mums that have brought themselves down to the baby and probably working towards getting a sore back. So we know that particularly breastfeeding is something that you're going to be doing over and over and over again. So it's really important that you take good care of yourself as well as doing all the right things to get the baby fed as well. I guess another thing that you'll be doing a little bit of is changing nappies. Maybe this is more the dads that are doing this. And what we don't want to do is really bend our backs when we're bending over the nappy, because we don't want any back injuries. Especially you've got busy jobs. Being a parent has got lots of benefits, but it's got very poor sick leave arrangements, very poor work cover arrangements. So it's very important that you take good care of yourself when you're looking after your bub. So make sure that when you are bending forward that if you're bending, you bend at your hips or bend at your knees rather than bending at your back. Sometimes if you have got the option, you can lift up your change mat a little bit higher so that it's at a better height. So this change mat, while looking lovely, is actually a little bit low for me. It would be much better if it was up at this height, so I don't have to bend forward so much to get to Bubby. So that was all I was going to do, is give you a little pointer in the right direction for looking after your back while you're looking after your bubby. And then the rest of the time I'm going to spend looking at ways you can encourage normal development in your baby. And I guess some of you here or have heard of tummy time. Just pop your hand up if you've heard of tummy time as being something we want babies to do. The mums in the crowd have put their hand up. Good job. And the reason that we encourage tummy time is to encourage neck strength and also to encourage good head control in babies. So when you come across, I guess head control is something that a lot of people are aware of with babies, that they don't have very good head control. So my baby is, what did Belinda say before? She's been little for a long time. So, in fact, she's actually not mine. She belongs to my 11-year-old, but she happily let me take it out of the house. The 5-year-old wasn't so keen when this baby left. But she has had a hard life, so excuse the crayon on the head, the glitter up the nose. Now we do have some other babies here. We've only got one actual baby here, and he's snug as a bug in his stroller. But we do have some other slightly oversized newborn babies here. If anybody would like a practice one. Now I might just unwrap my bubby. So anyone keen on a baby? Well, you're all keen on a baby or you wouldn't be here. But one of our slightly oversized ones. Practice does make perfect. There are prizes for participation. And you don't have to keep that baby. So we know that it's the recommended sleeping position for babies is lying on their back, and so we all want our babies to sleep on their back, but we also want them to get some time on their tummy as well. And the time that we talk about them having on their tummy is playtime. And I'm not sure if any of you guys have come across too many newborns, but they don't tend to do a lot of playtime. They're either having sleep time, feed time, maybe a bit of burp and cranky time, but by the time you add in the nappy changes and the bathing and all those kind of things, there's not a lot of playtime. So when we talk about tummy time, we might see if we can get you to use some of those activities that you're doing anyway with Bubby to spend that time on their tummy. So why is it important? It's important to have that bit of tummy time or to develop that head and neck control, because that's the first building block in babies' physical development. So when babies are first born, I don't know if any of you guys have seen a newborn lately. They'll often lift up their head, they'll give it a little wobble, and they'll let it flop back down. So they don't have a great deal of head control. If you leant them forward this way, their head would flop back, and so they always say support their head at the back. So newborns don't have a great deal of head and neck control, but that's the first building block towards being able to enjoy that time on their tummy, being able to roll over, and from that skill of being able to roll over, they get into the position where they can get themselves up to crawling, getting themselves with a nice strong back and spine to be sitting, and then pulling themselves up on furniture, cruising around the furniture, and eventually walking. So while we're not expecting them to be walking until they're 14 months, 18 months old, we definitely want them to start on that road to that good physical development from earlier on, and that first step is developing that head control. The other reason that we really encourage that tummy time is something called plagiocephaly. Has anybody heard of plagiocephaly? Or it's the medical name for a little flat spot on the back of the baby's head that's not in the centre. So and often newborns can develop a positional preference where they prefer looking to one side and not to the other side, because they're spending a lot of time on their back. That preference means that they're always looking to that side. They're putting extra pressure on one side of the back of their head, and they end up with a little flat spot, and it can go on to cause problems if they end up having that flat spot. They enjoy lying on that, so that it's even easier for them to look to that side, and they don't look easily to the other side. So we want to avoid that positional preference as well. So the first thing I guess you can do with your newborn, and if you're at the hospital, you can watch what the midwives do with the babies, because they're very adept with handling newborns. And so the first thing you can do to help develop some of that head control is pick them up through side lying. So Bubby's lying down on their back. So I don't know if you guys can see my baby very well. So they're lying on their back, but if you roll them over and pick them up, so you guys can have a try with your practice bubbies, roll them over and pick them up, you don't actually have to hold their head. They've actually got good sideways head control, and so you don't have to hold their head. So popping them back down and then over onto their back. So if you see the midwives picking up the babies, that's how they'll do it. Roll them over to their side, pick them up, and they're starting to develop some of that head control. Now, if you put a newborn baby over onto their tummy, it's not a very exciting thing for them. You usually hear about it pretty quickly. They'll start to squawk about it. It doesn't look like much fun. Not a quality father-daughter time or mother-baby time, is it, with them over on their tummy. So the really good alternatives for newborns are to perhaps try over your shoulder. So especially they like this with dads, because dads often tend to have broader shoulders. So pop Bubby over so their arms are over as well, and they'll do that position that I talked about before. They'll lift their head up, give it a little wobble, and pop it back down, and then they'll eventually work at holding up. Yeah, have you got a fake one at the back? It looks real from here. From further away, they look more realistic. Up close, not so much. So that time over your shoulder is lovely. Over your arm is another one, and this can be quite nice if they're a bit unsettled in the tummy as well, because you've got that nice pressure of your shoulder in against them, and it's a good position to give a little bit of a pat or a bit of a rub as well. So another position that babies enjoy is over your arm. So if you hold them between the legs or around the legs, pop her over your arm. And then this is quite a good position because it leaves this hand free to use your phone. It leaves, it does leave one hand free so that you could put the keys in the door and get yourself into the house. So over your arm is another one. So if you pop Bubby over a little bit more so she's on her tummy. Yep, that's it. Good. And hold her between the legs. Beautiful. Beautiful. So this is a nice position because, again, you're putting a little bit of pressure on their tummy, so they're enjoying that. But they've also got that other opportunity to work up against gravity, and it's nowhere near as boring as lying down on the mat. So they've got a lovely field of view and can enjoy seeing quite a few things down in that position. And then another great option for newborns, which is often a popular one with the dads, is on the chest while watching television. Or the baby doesn't have to watch the television. The dads are usually watching the television. So if you've got a nice, or you can lie on the lounge or lie on the bed or recline on your recliner, then that's a lovely position to have Bubby. They love being close to you, and they might even enjoy a little bit of telly. So turn their head and have a look. And so that's a nice position for having some of that tummy time. Another, I guess probably the final on you option is across your lap. So it's a bit hard for me to demonstrate that without a chair, but you guys everyone can see a baby from here. So beautiful job, you're experienced. So across your lap is a lovely position for Bubby as well, and that can be another nice one for a rub on the back or a little pat on the bottom. If they've got some wind, yep, you can cross your legs, beautiful. Yep. So that's another option for tummy time. So over that first month or two, they're the great positions to try with Bubby. Now the next thing to try is to get them onto the mat. So once they've developed a little bit of that head control, then we want to give them short periods of time lying on their tummy on the ground. And actually, the floor is a great place for babies to spend some time. So I think it can be easy to be drawn into all the different things that you can buy your baby to enjoy playing with, but they actually do really enjoy some time playing on the floor and exploring their environment. So whether it's on their tummy or on their back, the floor's a good option. So if you rolled up a little nappy or a little towel or a little bunny rug in a little horseshoe, pop it down on the ground, and then we can pop Bubby onto that so their arms and their head are over the top. And I have to hold her bottom because she's got quite a heavy head. But that's a nice position for them to start enjoying some time on their tum. So hopefully that's given you some good tips to get your baby started with enjoying that tummy time. One other thing, that's the other thing I was going to talk about, the positional preference. If you notice that your baby is looking to one side more readily than looking to the other side, one of the first things to do is to encourage them head and neck and back strength. But the other thing you can do is encourage them to look to that opposite side. So things that babies like to look at are light and dark. So sometimes the shadow of leaves on the window is something that they really enjoy. My kids always had quite a strong love affair with the ceiling fan. They loved the ceiling fan flicking around. The looking out the car window is one that they enjoy, or they like engaging with what's going on. So if you have a bub that enjoys looking this way and you want to encourage them to look that way, and you've got a friend that you're sitting talking to, if you hold them in a position where they want to follow what's going on in the conversation, they'll turn their head towards your friend. Or if you're watching telly, they'll want to turn their head that way. So instead of holding them this way where they can see exactly what's going on, holding them this way so that they want to engage and enjoy that conversation. But physios are well placed to give you some extended professional advice if you do have any of those problems. I just want to spend the last minute talking about baby massage. So we know that touch is really important for normal bonding and for development in healthy babies. It's not something to do when your baby's cranky or upset or in pain. It's a lovely thing to do when they're quiet, when they're alert, and when they're having that awake time. And it can be a lovely time for parents and babies to spend together. And it's a nice way of relaxing them and also relaxing you. So tummy time might be an option for a bit of massage. So especially their bottoms are so cute. So change time or bath after a bath time, if they enjoy their bath, can be nice for a massage. And we know that long, smooth strokes are what bubbies enjoy. And you can go down their arms and down their legs as well. So on their tummies one. And I guess it's like us. We like being touched as well. So faces, they like. So you can have a little massage. It's not the same without them being a real baby, is it? And lovely stroking down their legs. And massaging their feet as well. So, yes, the fake baby's not quite so good. No. She does appear to be enjoying it. She's quietly alert. Yeah. She hasn't cried at all. Not even on the way here in the train. So yes, baby massage is a lovely thing for baby development as well. So just while you're there, I'm going to get you to remind yourselves to sit up nice and tall again. And before I leave you to your next session or before you get up and move, I'm going to get you just to try rolling those shoulders back, nice and tall, lovely. Good job. People in the crowd can have a go as well. If we all do it together, it doesn't feel nearly as silly. And then bringing your arms up in front, and you've got to be careful of the person beside you with this one. So maybe turn a little side on and give a nice stretch to between your shoulder blades. Yep. So these are lovely stretches to have a try of after you've been sitting for a while. But I'm thinking more particularly about after you've been feeding your bubby for a while, pass them over to someone else to do the burp and the change and all of that kind of stuff, and then you can do some nice stretches as well. So thank you everybody for coming along. Thank you particularly for the people that humoured us by taking lovely care of our babies. And good luck to all you pregnant ladies. Thanks.